Hi, this is Brian from Davis Foot Orthotic Solutions. Welcome again to our web series, Insights from the Speaker. Today's guest is James Megna, who is a physical therapist. He is also a clinical expert as well as consultant for vestibular rehabilitation. He is a board-certified neurological specialist by the American Physical Therapy Association and VP of Clinical Services at Southside Hospital in Bayshore, New York, which is part of the North Shore LIJ Health System. Jim will be presenting a course for Davis Foot Orthotic Solutions on March 11th, 2015, entitled An Update of Vestibular Rehabilitation, Does It Really Work? Welcome, Jim.
Good morning, Brian. It's a pleasure to be here.
All right, I really appreciate you coming. So Jim, tell me about yourself, a little bit about yourself, a little bit about your career as a physical therapist.
Well, I graduated State University of New York at Stony Brook in 1989. My first job was at Southside Hospital, and I've been there ever since. Started out as a staff physical therapist and kind of climbed the ladder from there.
Well, tell me a little bit about the ladder.
Okay. Well, Southside was first really just a small community hospital. We had a lot of therapy at the bedside, and we had an outpatient program that was squeezed into a very small space. I kind of remember you climbing over patients to try and get to them when we were there.
Yes.
And over the years, Southside has developed a very aggressive, multidisciplinary rehab program that addresses the entire continuum. And I had the opportunity to have multiple careers within the same institution. I was on the inpatient rehab unit, brain injury unit, and clinically wound up in the outpatient center where we really had an opportunity to develop the balance and vestibular clinic. And then my last role within the rehab department was director of the program.
Okay. And so you're not the director anymore?
No. About 2.5 years ago, I moved into administration, and in my role, I'm overseeing rehab plus the clinical operations of the ancillary services. So that would be pharmacy, laboratory, radiology, respiratory, and so on.
Well, congratulations. That's great to hear.
Thank you, Brian.
All right, so now let's talk a little bit about what got you interested in vestibular rehab.
That's really interesting, and actually it stemmed from a conversation with you. If you remember, we were looking at how we can address balance disorders in MS patients using orthotics.
Yeah.
And I started to do a literature search, and this system called the Vestibular System kept coming up, and I had heard about that in school, but back then, which was probably when we were still writing on stone, we really didn't learn much. There wasn't as much information out there 26, 27 years ago as there is now. And so because it kept coming up, I said, you know what, maybe I should investigate this vestibular system. So I went to a continuing education course at the Research Institute of Chicago. Little did I know that every major name in vestibular research was there. Susan Herdman was there, Ron Tusa was there, and it was just a terrific
How about
course.
Lou National? Was he there?
Lou National was there. Yep, everybody was there.
Yeah.
It was a big vestibular jamboree, and that really put the hook in me to follow that.
Those courses are exciting, right?
Yes, they are.
They get your blood going and get you in a direction that you thought you'd never be in.
Right.
So tell us about the vestibular clinic that you established at Southside and what goes on there and who should go there.
Right. We were the first clinic, probably on Long Island, maybe in New York, to address vestibular symptoms. And I remember the first time I had a patient with benign positional vertigo. He came in and I did the Hall Pike maneuver on him, the Epley's maneuver. And I remember that I put him in the position, and this is the first time I ever did this maneuver.
Yeah.
I had no idea what was going to happen. And his eyes are going wild, and he's screaming, and I'm forcing him through this maneuver, and I finally get him through the whole thing, and he's just sweating, and he's white. And I said, okay, come back in about 3-4 days and we'll see how you're doing. And I thought I'd never see him again.
Yeah.
But he came back 3 days later crying because he was cured.
Wow.
And he had struggled with this for 10 years and nobody was able to help him.
Yeah.
And that was just an awesome thing. I knew we had something at that point. And that's when we really put the resources into developing what we have now. And you know, we have posturography, which is a big breakthrough in technology in looking at vestibulospinal reflexes. We have imaging of oculomotor reflexes. So these are really big technological breakthroughs in the rehab field, and really has carved out a niche for us of expertise that we can leverage in really helping our community.
Wow, that's great. So let me then ask you about the course that's coming up.
Sure.
Right, you've been lecturing for many years, you know, all over the place. You're a consultant. You go across country. You help establish clinics. So tell us about this course and you know, what it's going to provide for people that may attend.
Well, this course is kind of like an update on where we are in the field of vestibular rehab. One of the questions that I had received from physicians, even still today, is, you know, does that stuff really work? You know, is it just all in the head? Well, in a sense, I guess it is all in the head.
Yeah.
And, you know, seeing that your ears are in your head.
Yeah.
But you know, there are many more physician believers today than there were back then, but there are still doubters. And really, it's good for us to understand that there is empirical evidence that supports what we're doing. So the person who comes to this course should have a basic knowledge of what vestibular rehab is, and really should have, at least every once in a while, be treating a patient with vestibular dysfunction. But what we're going to do is look at the evidence and see how we can fine-tune our interventions to get the best possible outcome on our patients.
Okay. So physical therapists assistants,
Yep.
Occupational therapists.
Anybody who touches a vestibular patient, even an audiologist would be interested, I think, in coming in to see what it is that we're doing. And, you know, there are folks who will be referring to us, you know, even if it's through another physician. So I think it would be important for them to hear this.
Okay. Well, thank you very much, Jim. I really appreciate you taking time out and talking with us today.
My pleasure. I'm looking forward to the seminar.
All right. Thank you very much. So there you have it. Again, the course is entitled An Update of Vestibular Rehabilitation. Does It Really Work? By James Megna here in St. James, New York on March 11th, 2015. I'm really excited about it, so don't miss it. Try to be there if you can, and then stay tuned for another episode of Insights from the Speaker by Davis Foot Orthotic Solutions. Take care, everybody.